Hello and welcome back to our channel, Ashdonic Training Solutions. As you know, this channel is about discussing anything clinical. And for the purpose of this video today, we thought to be a good idea to look at some of the core values around some of the stations for the OSCE. For those of you who are doing the OSCE, we did promise we'd give you weekly videos, and this is part of that promise. So for today's video, we're going to be looking at the evidence-based practice stations. Not so much the details of every individual station, but to give you the core values of what underpins those section and some of the core tips of what you can do to make sure that you pass on the first go. So the aims and objectives, we're going to understand the expectations and the structure of the evidence-based stations. And we're also going to critically appraise the nursing interventions using nursing principles, theory, and the best practice. So just before I go to the next slide, please like, subscribe, comment on our channel. All the support is really needed. We're trying to do a lot of things in the background, try to get the sound right, try to get the lighting right, but all of that takes your support. So please like, subscribe, that's really appreciated. So evidence-based practice, what does that really mean? So evidence-based practice is the process of collecting, processing, and implementing research findings to improve clinical practice in the work environment and patient outcomes. Well, this is very important for the OSCE stations because they felt that sometimes we're doing things and we don't quite know where the information is coming from. Why do we do what we do? What is the theory behind it? And what are the meta paradigms behind it? So once you understand the theory, the logic, and all the underpinning legal frameworks around something, then you're likely going to do the best work possible anyway. So that's why that's very important. Now let's link this into our NMC code. Looking at platform 1, being an accountable professional. The platform 1, I'll read it. It's quite wordy, so please bear with us. So, being accountable professional, registered nurses must act in the best interest of the people, putting them first and providing nursing care that is person-centered, safe, and compassionate. They act professionally at all times, using their knowledge and experience to make evidence-based decisions about care. They communicate effectively, they are role models for others, and accountable for their actions. Registered nurses continually reflect on their practice and keep abreast of new and emerging developments in the nursing healthcare industry. So that just starts to reinforce the message we're saying, that understanding the background, understanding what we do, being accountable in the way that we carry out our duties, all of this goes towards being an accountable and a professional nurse. The next platform is assessing the needs and planning care. When you start looking at the stations, you're going to be faced with an issue that you're going to link with your evidence-based practice. That's why this is a very important platform to also look at. So assessing needs and patient care. Registered nurses prioritize the needs of the people when assessing and reviewing their mental, physical, cognitive, behavioral, social, and spiritual needs. They use information obtained during assessments to identify and prioritize the requirements of the person-centered and evidence-based nursing interventions and support. They work in partnership with people to develop person-centered care plans and take into account circumstances, characteristics, and preferences. So like I say, it's quite wordy, but again, once you've understood all these principles, you won't have a problem on your silent station, the evidence-based practice. So introduction. So evidence-based station is a silent station. What that means is you won't have to engage with the patient. You'll be faced with the tabletop assessment. All you have to do is read the information, and then you do bullet points in regards to how you'd address that situation. You'll get 10 minutes to work on your evidence-based station. So all you have to do is read the scenario before drawing out conclusions. Ensure writing is clear and legible when you complete all the sections. And you complete one scenario out of 5 possible topics. So some of the topics you might get might be diabetes, femur myocardial infection, pressure ulcer prevention, smoking cessation, and the use of honey dressings for venous leg ulcers. So a few quick tips on how to address this station. In order to pass this section, the approach remains the same across all subject matters. Ensure you read the scenario carefully, drawing out the most relevant information from that station. Keep bullet points and key findings from from what you've read. Reference the information available to the learning portal. So think about things like NICE guidelines, the Royal Marsden Manual for nursing procedures. Look at the legal frameworks that might be involved in that station. If you start putting all of this theory in addressing the station, that will give you a higher chance of showing that you've got the knowledge and the skill to approach that station. Keep the answer specific to the scenario. And remember to satisfy all aspects of the marking criteria. Like I say, for any station, once you know the marking criteria, then you think about how do you make sure you hit all the points that make sure you satisfy all those aspects of the marking criteria. So critical thinking and discussion. Always think about the who, the what, the when, the where, the why, and the how. Why is this very important? It's then important when you're looking at your station. If you're faced with a situation that's community facing, also make sure that your answer is community facing based. If you look at an inpatient scenario, always make sure that it's an inpatient based answer. So it's very important when you're reading that you think, how am I going to approach this, and will it remain relevant to the scenario that you've been given? So, assessment criteria. First situation, they want you to summarize the main findings. So in the article that you've read, make sure that you draw out conclusions, making recommendations for practice. Write clearly and legible. If it's not clear or legible, then your markers won't be able to draw out the conclusions. They won't be able to support what you've just written. And you don't want to miss some of this very pivotal information because of a bad handwriting. So please, clear, legible handwriting is very important for the station. Inform the patient and the staff of the nursing strategies that are effective to manage the situation. So if you're going to be giving an advice to the patient as part of the scenario, make sure that it's very clear, you're using simple English, less jargon. You're not in this exam to impress anyone. You're just there to evidence that you've got the skill and the knowledge to be competent nurse. So in your discussions, look about your early warning signs, the triggers, give solutions. In your advice, making sure you're using your nursing strategies, using nursing language. That's very important. Only emphasize on the main points before you then positively acknowledge the patient views. So this is very important. You might get some situations where a patient, or you're being given a scenario where someone is not agreeing with the best practice. Yes, that's fine. You give the evidence-based conclusions, but it's also important to acknowledge the views of the person that you're addressing as well. Hopefully that gives you some of the core information that you need. We're going to go on the specific evidence-based stations in other channels, but I just thought this was important because once you understand the core values, how to approach these stations, you'll be fine no matter what topic you're given. Hopefully that's helpful for you guys, and see you on the other videos. Please keep liking, subscribing, commenting on our videos. This is very helpful to all of us, and we'll see you on the next channel.